McBride, and I am a program manager, a prevention specialist here at DrugFreeAZKids.org. We are a program of Southwest Behavioral and Health Services, and that is something new. So if you're just joining us this month and you haven't been here for a couple months, that may be new to you. We became part of the Southwest Behavioral and Health Services team towards the end of last year, and we're really excited to be part of this bigger family that will allow us to hopefully reach more people across the state of Arizona and provide the resources that we have to offer, learn a little bit from Southwest Behavioral and Health Services, and really combine to provide the most comprehensive resources possible as it relates to preventing drug and alcohol abuse amongst young people here in the state of Arizona. Today's webinar is Adverse Childhood Experiences, also known as ACE, and Substance Abuse. Before we get into that, I want to let you know a little about what we do here at Drug-Free AZ Kids. What we do is we provide resources, parents and community groups, schools, churches, and a number of other groups across Maricopa County and even across the state of Arizona through one of our other programs relating to keeping kids from using drugs and alcohol. And we do that in a number of ways. One of them is providing webinars like this on almost a monthly basis. We also do what's called active parenting workshops. This is a curriculum that consists of 6 active parenting workshop sessions, 2 hours each, and we talk about everything from self-esteem, building cooperation, communication, as well as prevention strategies within a home. And it's a great program for parents, aunts, uncles, caring adults, pretty much anybody who has an interest in raising healthy, drug-free kids. And it takes more of a holistic approach to prevention rather than saying just drugs are bad. Because we know now, if you are in prevention, that preventing drug and alcohol abuse among young people, there's really a lot more to it. And it's about providing different skill sets and building the qualities of character instilling the qualities of character that we like to see in young people. We also do one-time presentations at different groups throughout the county, and that talks about drugs, the top 4 drugs abused by young people in Arizona. That'd be marijuana, tobacco, alcohol, and medicine. And we also provide different strategies for preventing drug use during those one-time workshops. And those are presentations. Those can be anywhere from 45 minutes to an hour, hour and a half presentation. We also send out a monthly e-newsletter that's composed of different articles and links and resources for anybody that's concerned about young people. And then we have all of our social media messaging that we send out as well. So we really try to tackle the problem of substance abuse from multiple angles because we know it's a big issue and it can be a big hurdle and a big roadblock for a lot of young people in becoming successful, responsible adults. So that's why we do what we do. Me, I am an Arizona native. I've been here most of my life. I was in the Marine Corps for a little while, and I lived in California for a little bit, and before coming back here to Arizona. And prevention programs and empowering youth, empowering families, anybody who has a vested interest in raising healthy, young, drug-free kids, that's really a big passion of mine, and I've been doing that in a variety of programs over the past several years. And I'm excited to be able to talk to you guys today about adverse childhood experiences and substance abuse. What we're going to talk about today is these are like my 3 goals for the day. If we can get through these, that's what I'm really looking for. And number 1, what is the ACE study? What is the Adverse Childhood Experiences study even about? Some of you attending the webinar today may know a ton about it. Some may know very little about it, and that's okay. That's what we're here for today, to talk about maybe a brief introduction to the ACE study because we could spend an entire week talking about the ACE study and still not even tackle all of it. So today it's kind of an intro to adverse childhood experiences. Then I want to also talk about what do these adverse childhood experiences have to do with substance abuse? And lastly, how can we make a positive impact? And once we get into how we can make a positive impact, that's going to be not just me talking and sharing some ideas that I have and we have here at Drug-Free AZ Kids, but I want to hear from you. So have your thinking caps on throughout the webinar and let me know towards the end. We can talk, we can discuss this, and we can hopefully come up with some ideas together for ways to tackle some of the problems that come out of adverse childhood experiences or the childhood experiences themselves. How do we prevent them? So have your thinking cap on, and if you do have questions throughout the webinar, feel free to ask me in the chat box, just like we have Alma, who asked something right now. Will the slides be available after the webinar? The full recording of the webinar actually will be available as well, and we'll have all of that available on our website at DrugFreeAZKids.org/webinars, where you sign up. If you scroll to the bottom, that's where we keep our archive of the webinars. I also send out an email to all of our webinar participants. Following the webinar, typically I send it within a few days that has a link to the webinar that's recorded, as well as any of the resources and further information, further reading that you may want to pursue. So thank you for asking a question. Any more questions, feel free to pop those in the chat box. I will do my best to get to them in a timely manner. If I don't get to it at that moment, I will be getting to all the questions at the end of the webinar. So make sure to put them in there if you don't have a piece of paper to jot them down. Okay, so before I get started into kind of our presentation, I found a great video that is an overview of what ACE, the Adverse Childhood Experiences, really are, what study's all about. And this is a video that was actually a student project that I came across, and it's about a 4-minute video, and it's going to give you a snapshot of what ACE is all about. And then from there, we'll be able to get into a little bit more detail about ACE, substance abuse, and what do we do from there. So I'm going to put this video on right now just to let you know. I'm not sure if the volume will change, so be prepared. If you might have to adjust your volume a little bit here.
The Adverse Childhood Experience study was a collaboration between Dr. Vincent Felitti at Kaiser Permanente in San Diego and Dr. Rob Anda at the Centers for Disease Control and Prevention in Atlanta.
Developed a number of years ago to help medical practitioners primarily, but now educators also, to understand adverse childhood experiences, or essentially childhood trauma.
The beauty of something like learning about ACEs is, I would guess that there are very few people who don't have a moderately high ACE score themselves or know someone who does.
Which, even though the ACE study was published in 1998, it's only fairly recently that it's receiving major attention.
ACEs are not considered after 18. You can have trauma, but the impact is more significant in developing brains.
ACEs are major drivers. They may perhaps be the largest individual, potentially modifiable input to healthcare costs.
The purpose of the survey is to understand 10 major childhood traumas, which range from anything that include sexual and physical violence in the home to neglect, and various other forms of trauma and violence that can occur in home, community, or school settings.
The higher the ACE score, the more physiological and emotional impact a person can experience.
Because of a psychological impact that's driven by the neurobiology. So kids don't achieve as much in school. They don't try as hard in different activities. They end up putting themselves inadvertently at risk for other potential traumas, and it just builds from there.
All of our healthcare systems are having to confront these diseases and these problems, especially in the mental health areas and in the substance abuse areas. Those are highly associated with prior traumatic experiences.
Patients have started to work on trauma resolution. That's when you start to see the resiliency factors at play, and so a downplay of the trauma impact and increase of resiliency, and you start to see people emerge for who they really are.
All sectors of society need to be well informed about the relationships between severe stress and trauma and an individual's success in their lives, their health, their productivity.
We have several students who've had one or more parents deported, who do not live with their biological parents, who have parents that are involved in gangs, who were severe drug users. So all those kinds of factors can be compounding.
And the more we can talk about these issues and make it common terminology, we start changing the equation, and the issue of trauma no longer becomes such a scary thing, because we also know that there's hope in that there's resiliency within each individual. And this is important because people don't have to remain traumatized. They can learn to have how they can impact their own life and have a better life.
Students with higher ACE scores have a greater likelihood of using alcohol or substance abusively, greater likelihood of smoking, increased risk of high blood pressure, of heart disease, and earlier death. That really spoke to me.
Okay, so that is a little bit of an overview of what ACE is all about. I know there's a couple people that were having some technical issues there. I do apologize for that, but it looks like most of you were able to hear what the overview was all about. And it shows us the importance of ACE and looking at adverse childhood experiences. If you weren't able to see or hear the video in its entirety, I'll make sure to include a link to that in the follow-up email as well. That way you can all see that. So looking at what the a quick recap of some of the points of that video. The Adverse Childhood Experiences was a collaboration between Kaiser Permanente's Health Appraisal Clinic in San Diego and the Centers for Disease Control and Prevention. This was a collaborative effort between the two of those organizations, and over 17,000 people took part in the study, which is really a decent number of people to take part in this type of a study. And what the findings show us is that there is a relationship between adverse experiences and a poor quality of life, risk of illness, and even death for individuals here in America. And one would say just because a study's here doesn't mean that it's only true in America, but true for adverse childhood experiences, no matter where you're at. The study has also led to additional research relating to trauma, the lifelong impact that trauma can have on young people from a young age onward up into adulthood. And so the study was really hasn't gained a lot of momentum until recently. It's been around for a while. This was in looking at the 90s when the study the findings from the study were released, and early 2000s we heard a little bit, but really hasn't been a lot on adverse childhood experiences. But as we learn more about substance abuse, as we learn more about mental health, people started going back to the ACE study and realizing there's a lot more that we need to find out, so that way we can figure out how to tackle different mental health issues as well as substance abuse problems here in our state, in the country, and worldwide. These are the demographics of those who were involved in the study. So it's just about half and half for men and women. Looking at the race, you can see race, education levels, age. It does vary. This was looking at access to health care, because this was provided in a healthcare setting. Access to health care probably is a major player in getting people to participate in the survey, which as we get through this, that'll show us how people that may not have been able to get to have, to the point, to the waiting room or wherever it was that they were asked if they wanted to participate in these studies, how this is even a bigger deal probably than the study can even tell us, just based on the people who may not have been able to get to the place where they would even take the surveys. It is primarily middle class the wide range of middle class that we do have in America, that stands true with the demographics of this study as well. What I want to do is I'm going to actually show you the 10 main questions that the ACE study tells us about or talks about. And the original questionnaires they were a little different than this. They were a lot more extensive. But it comes down to these 10 questions, these 10 categories of questions. And I just want to give you some advance warning. If you have had traumatic events in your life, these questions may bring some of that to the surface. I'm not going to ask anybody to share out loud or in the chat box. This is just going to be something internally. It's not going to be a poll question where you have to click anything. I just want to give you a heads up that we are going to talk about some things that are difficult to talk about. So if any point throughout the webinar you get a little uncomfortable, there's nothing wrong with turning it off and coming back at a time when maybe you feel more comfortable watching it, because the webinar will be recorded. So the first question, it's broken down into 10 questions. So before your 18th birthday, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? And as we go through these, if you want to kind of keep a tally in your head of how many of these that you agree with or you would answer yes to, and you can just keep that in the back of your head if you'd like. Second question, before your 18th birthday, did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? And the key words here are often or very often. Not that pushing, slapping, or throwing is something at a child is ever acceptable, but the main point of this is it's something that was a regular occurrence in the home. Before your 18th birthday, did an adult or person at least 5 years older than you ever, so at any point, ever touch or fondle you or have you touch their body in a sexual way, or attempt to have anal or vaginal intercourse with you? Question 4. Before your 18th birthday, did you often or very often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? Question, before your 18th birthday, did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Question 6. Before your 18th birthday, was a biological parent ever lost to you through divorce, abandonment, or another reason? Before your 18th birthday, was your mother or stepmother often or very often grabbed, slapped, or had something thrown at her, or something often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Question 8. Before your 18th birthday, did you live with anyone who was a problem drinker or alcoholic, or used street drugs? Before your 18th birthday, was a household member depressed or mentally ill, or did a household member attempt suicide? Question 10. Oh, actually, sorry, that was question 10. So it looks like that one was, we may have repeated one there. And it looks like for some reason the last one's not popping up. It's stuck there. And the other question, but it will, before your 18th birthday, was a household member ever sent to prison? So looking at those questions, as we now go through those, you can see they're very deep questions. And adverse childhood experiences aren't merely, were you bullied once in your life? While bullying is never acceptable, these really look at the core experiences that a child has when they're younger, and what will kind of stays in the back of their head as they're growing up. Some of them, as you can see, were, did this ever happen to you? And other questions were, did this often or very often happen to you, or to someone in your household for some of them? So it helps us gauge what was really going on in that young person's home. And that's what adverse experiences are really about. And looking at how you scored on that, this is not a test that we want to score high on. Unfortunately, we may score high or know someone that scores higher than we would like, and it may make us feel uncomfortable. And first, let me just preface, it's okay to feel uncomfortable about this. It's okay to not like how high a score is. It's okay to talk about any of the issues that the adverse childhood experiences may bring up. It's okay to not them if you're not ready for it. We just need to get past a certain stigma that we have here in society relating to some of these experiences. How do people score? How common are ACEs? This graphic shows you, this comes from the Centers for Disease Control and Prevention. There's a lot of great graphics that they have I'm going to be using throughout this webinar and from some other organizations, and I'll let you know who they are throughout so you can find more about them and use the graphics in the work that you do if you'd like. So how common are ACEs? Well, looking at 36% of individuals answered no to every single question on there. So looking at that, you're like, okay, well, that's high. The majority of people looking at it, you would think, well, actually, no. The majority of the people answered yes to one or more, because that means that 64% of individuals had at least one or higher. 26% of individuals answered yes to one of these things, 16% for two, 9.5% for three, and 12.5% for four or more. So that gives you a little bit of a breakdown of ACE and how common they really are. So if you'd answered yes to 1, 2, 3, or maybe more of these, don't feel like you're alone. Or if you have a family member that maybe some of us, we're thinking about an individual that we know. It could be somebody we work with. It could be a nephew. It could be one of our own children or an adopted child, or if you're a teacher, one of the students in your class. And I know a lot of times as we go through this, we're answering these questions not about ourselves, but about that person we care about. So if you answered 1, 2, or 3 or more relating to yourself or this other person, don't feel like you're alone or that it's unique. This is a large problem that we need big solutions for as well. And the more that we realize that it is common, the more I think the easier it becomes for us to stand up and say, we need to do something about this. So the types of adverse childhood experiences that are out there, again, from the Centers for Disease Control, breaks it down into these 3 categories: abuse, household challenges, and neglect. Another way you may hear people refer to this as household dysfunction. That's another way that people refer to the household challenges. Abuse is broken down into emotional, physical, or sexual. For household challenges, we're looking at mother threatened violently, substance abuse, mental illness, separation or divorce, or incarcerated household members. And then neglect, that would be emotional or physical. And if you notice, there are 10 different categories within total among those 3 major categories, and those relate to the questions that were asked. on the original survey that was given out, they were broken down into slightly more questions, so that way it wasn't one big question about substance abuse. It was kind of broken down a couple different ways. But for the purpose now, and I took those questions, the wording from those questions, actually from a great article from NPR, National Public Radio. And if you want access to that, check out the email after this webinar is over for a link to the quiz that they have on their website as well. So looking at all of the different types of ACEs that are out there, we can start to understand where certain risky behaviors may come from, or risk factors may come from. Now, this is a pyramid. This is how the CDC shows the impact that adverse childhood experiences have. And this goes from conception to death, the whole life perspective, as they call it. And I'd like for you to look at the very top. Ignore everything else and just focus on the top pyramid that says early death. So if we go one step back, we see disease, disability, and social problems. So we see, okay, well, this is why people die, because of disease, disability, and these social problems that they may have. And as we step farther and farther down, it kind of takes a look at substance abuse prevention, or just prevention of illness in general, and how it's progressed over the years, and how we're learning more about preventing different steps in this ladder. So then we go one step below disease, disability, and social problems, and that's the adoption of health risk behaviors. So right there, that's where, if you go back maybe into the 80s, we looked at, well, if you're using drugs more often, you're going to be more likely to maybe to develop different types of cancers or diseases or different social problems or disabilities relating to those risky behaviors. And it could be not just substance abuse, but other risk behaviors. It could be your eating habits, different things that relate to those diseases, disability, and social problems. So adoption of health risk behaviors. Well, that's why years ago our primary focus was, let's just prevent these behaviors. Let's just get people to stop doing these things. If we just tell them that it's bad, say, okay, it's bad to have foods that are high in cholesterol. It's bad to drink too much alcohol. It's bad to use illicit drugs, right? If we just tell people that this is harmful, then they'll know. So it's just, we thought people just don't know. If we tell people, now they're going to know. And that is true for some people. Some people just genuinely had no idea that some of these things led to other risk factors. They just didn't know that. But for others, maybe we know that something's bad for us. However, the habits that we formed, we become dependent on these habits or these substances or these conditions in our life, and it's hard to break those habits sometimes. So we take a farther step back, and we look at the social, emotional, and cognitive impairment, trying to figure out why people are engaging in these risky behaviors, essentially. Why are people engaging in these risky behaviors? If we can impact those on the social, emotional, and cognitive levels, then maybe we can have an impact on the likelihood for them to adopt those risky behaviors, meaning they won't then develop disease, disability, and social problems, thus falling in early death or low quality of life. Well, now we're taking a step even farther back. We're realizing that there's these things called adverse childhood experiences, which this study shines a light on, and these adverse childhood experiences can lead to some of the social, emotional, and cognitive impairment. So, and it may sound like, wow, this is a lot. It's prevention of prevention of prevention of prevention, kind of the scenario. And what we're trying to do, we're trying to get at the root of a problem, right? We all know, and not that I'm relating myself as an individual to a weed, but it's a good analogy. Looking at a weed that's growing in your yard, if you take off the top leaves, what's going to happen? Well, there's going to be less weed growing in your yard that you can see. Well, then you go a little bit farther down, and maybe you rip off the top part of the stem, and then you go farther and farther down. What do we know? You know that you want to pull that weed from the roots, to pull it out of your yard. Anybody who's ever done any gardening or pulling weeds knows this. You're going to have a lot more of an impact if you can figure out what the problem is at the root and address that problem there. And that's what we're talking about, is trying to get to the root of some of the issues that we have, some of the root of early death, the root of low quality of life. We want to improve the quality of life. We want to extend the length of high quality life, as we should say. So we're looking at the root. And now we're looking at, today we're not going to really get into this, but if this is something that interests you in looking at what trauma is, adverse childhood experiences and trauma that people do experience in their life can also be shown to be passed down genetically. So it sometimes goes beyond just preventing those adverse childhood experiences from occurring, but kind of going back to their parents and figuring out how do we address that genetic marker that may be there, so to speak, and how do we address that? What do we do? And that's where kind of we're at when we're in mental health right now, and substance abuse prevention is looking at trauma and what the role that trauma has to play in the quality of life and how it impacts different people in different ways. And there's a ton of research out there on it. And I would love to get into that all right now. However, I know that if we do, we will all be sitting here until probably next month still talking about it. So I'll include those in the link of the follow-up email as well if you're interested in learning more about trauma. So that's a basic kind of view of adverse childhood experiences, the latter, and where adverse childhood experiences, the role that they play in the larger problem that we're looking at. This comes from the Robert Wood Johnson Foundation, and they break down let me go back for a second so I can relate this. If you look at the adoption of health risk behaviors, that middle tier right there, these right here relate to kind of that middle tier of that pyramid, if that makes sense. So looking at some of the different behaviors, relate the behaviors and physical and mental health, look at the different aspects, and in the middle, what are we really talking about? What are we trying to prevent? By figuring out what adverse childhood experiences are, addressing that, learning more about it, what are we trying to impact? We're trying to impact these things right here, those middle tiers of that pyramid. This is what we're trying to address by looking at adverse childhood experiences. We always take one step back to look forward, just like we did with realizing that, hey, when you have a high cholesterol diet, you're going to be more likely to die at a younger age. So things like that. This is just taking one step back. Adverse childhood experiences, if we can figure this out, we can talk about it and find solutions there, these are the types of things that will help, that will have a positive impact on. So how do ACEs affect your life? This is a fantastic, this is an interactive graphic. Here it's not interactive because it's a webinar, so I will take you through a couple of the different parts of this graphic. This is from the Centers for Disease Control, and it will go into all of these different behaviors and the likelihood of the behaviors depending on if you've answered yes to 1, 2, 3, or 4 or more of these ACEs. So here this is 0. This is just baseline what we're looking at, 0, and where the different behaviors fall in line. So as we increase from 0 to 2, as we look at 2 adverse childhood experiences, so answering yes to 2 of those questions, you can see how the likelihood of you engaging different behaviors or succumbing to certain things increases. Looking at the yellow, stroke, that's a major increase there. You can see stroke is one of the largest right off the bat. When you have 2 adverse childhood experiences or more, you have a higher likelihood of experiencing a stroke in your life. We also see a couple others that are big, that suicide attempts has also increased. Next to stroke, suicide attempts is probably the next largest that's right there. This is a great interactive graphic that I encourage everybody to go check out on the Centers for Disease Control and Prevention, their website. So you can see how they're increasing. Now, let's get to 4. Look at that. Once we get up to 4 or more adverse childhood experiences, the likelihood that an individual will attempt suicide dramatically increases. That's one of the the largest ones here. It actually is the largest for 4 or more. There's different studies that you can look at that go 5, 6, 7, 8, that get into the specifics of each average child adding 1 more. But 4 or more, this is kind of where we're at for a lot of people, some of the major categories. So looking at these, let's look at some others that are on there. We have depression, another major. We also have alcoholism. We have drug use. These are also major players there. Oh, I think depending the color grading on my screen's a little off. So before where I was talking about stroke, we were actually talking about alcohol. Sorry, that one threw me off a little bit. So we'll go back in case I confuse some folks. The major yellow dot here on the far left, that is going to be alcoholism. I thought that wasn't going to, stroke is going to be slightly larger, but not quite bigger until we get here to 4 or more where stroke is higher. But as you can see, drug use and alcoholism, you're at much greater risk if you have 4 or more adverse childhood experiences in your life. And when we look at the correlation between substance abuse and suicide or suicide attempts, you can see how those two are greatly connected and greatly impacted. And let's look one step farther. This is the life expectancy. For an individuals who answered yes to 6 or more adverse childhood experiences. So people who had 6 or more of those experiences in their life, they are nearly 20, or they're likely to die nearly 20 years earlier than individuals who answered 0. So that's pretty shocking, and that shows how much the average childhood experiences can really impact a person's not just quality of life, but their life expectancy. They're much more likely to die at an earlier age than if you were to answer no. And you can see a correlation as you add 1, 2, 3, or more. But looking at 6 or more, that's dramatic. We're not talking a year here. We're not talking 2 years. We're talking 20 years. So how does all of this relate to what we do here at DrugFreeAZKids.org? How do these average childhood experiences relate to the work that we do? That's what some people say. Well, yeah, we see that this is an issue. People that use drugs or have people use drugs in their house, they're more likely to be impacted. Well, it's not just at the adult level. The average age of drug use here in Arizona, first-time drug use, is 13 years old. So adverse childhood experiences aren't just lingering around that impact you later in life. They're starting to impact people at a younger age to engage in riskier behavior. And we know that the earlier a person engages in drug use for the first time, the higher likelihood that they will develop a dependency on a substance later in life. So you can see how all of these are really connected. It's not just an issue that we deal with when it's a child or when they're an adult, but they're connected. Adverse childhood experiences affect not only the children, but the adults that they will become. And that's if they get to be old enough to experience some of those problems, because we know the higher likelihood of suicide and early death when you have more adverse childhood experiences. So looking at the average age of first-time drug use, well, what are the substances being abused here in Arizona? Well, we have alcohol, we have medicine, cigarettes and e-cigarettes, other tobacco products, and marijuana. These are the main 4 categories of drugs that are abused in Arizona. Over 2/3 of Arizona youth will use alcohol, tobacco, and other drugs before they graduate high school. That's a lot, over 2/3 of kids. And this isn't just a guess. This comes from the Arizona Youth Survey, which is conducted every 2 years and surveys over 40,000 youth across the state of Arizona. So we know that these numbers are fairly representative of the larger population in Arizona. Alcohol consumption by Arizona youth. So there again, alcohol is the major substance that's being abused by young people in Arizona. 67% of 12th graders report consuming alcohol. Even 1/3 of 8th graders. So before they even get to high school, 1/3 of kids have already tried alcohol or drink alcohol on a regular basis. Looking at medicine abuse in Arizona, the abuse of prescription drugs by Arizona 12th graders, 18.7%. Just about 1 out of every 5 youth in Arizona, before they graduate high school, will use a prescription drug to get high. Let's look at cigarette use by Arizona youth. While all of these, including cigarette use, they're all declining, and we still have a long way to go, because the fact that 23% of kids are using cigarettes shows that the prevention messaging we're doing relating to tobacco has been working. The policies have been working, but we still have a long way to go. Still, almost a quarter of youth report abusing cigarettes in Arizona, or using cigarettes in Arizona. However, one substance that is doing the opposite of all of these other substances, we see all the trends going down, meaning the work that we're doing, the prevention efforts, the policy changes, it shows that it's working. So as we go down that pyramid, remember that pyramid, and we go one step further in prevention. As prevention efforts get better and more efficient, and we realize what we're doing, less kids are using substances, and that is awesome. And so we need to continue to go one step farther, one step farther. A substance that we are battling that has the opposite effect right now is marijuana. Marijuana, where all other substances have been dropping at a steady rate, marijuana use by Arizona youth kind of plateaued a few years ago when Prop 203 passed. And medical marijuana, as it was called in the prop, was legalized. And as discussions were changing and public perceptions of the health risks associated with the drug were changing, we saw more kids starting to use marijuana for reasons that they weren't before. So while the number hasn't spiked dramatically when you compare it to the overall trends of substance abuse in Arizona, where all substances are trending down at a fairly steady rate with Arizona youth, we see marijuana kind of where everything else is going down, marijuana just kind of plateaus right there. So this is one thing that we need to keep an extra close eye on as it relates to youth in Arizona. But there is a positive light here. Substance abuse rates, we know that kids who talk with their parents about the dangers of drugs and alcohol are up to 50% less likely to use drugs and alcohol. So those are great rates. And here it says talk with parents, but really talking with parents or caring adults, like aunts and uncle, grandma, grandpa, whoever the caring adult is in their life, has a major impact on the likelihood of a young person to abuse drugs or alcohol. So maybe you're a parent in this room, or maybe you're somebody that works with parents or works with people who care about young people, or maybe all of the above. There are things that we can do at different levels and at different parts of the game, whether you're in government, whether you're in education, nonprofit, the private sector. There's things that all of us can be doing and should be doing to have an impact here. So what can be done about these ACEs? What can be done about adverse childhood experiences? Well, one, educating people about them is key. And another big part of that, a part of this, is things like parenting classes. And this is one of the things that we do here at DrugFreeAZKids.org. We utilize the Active Parenting Program, which takes more of a holistic approach to drug or substance abuse prevention, rather than saying drugs are bad or don't do drugs, because if you use drugs, you're going to get cancer, you're going to develop this disease, or you're going to go to jail. It takes a step back, and it provides parents with the tools that they need to instill qualities of character in their kids that have been shown to reduce the likelihood of kids engaging in risky behavior, building high self-esteem, building cooperation, courage, responsibility, respect. Some of these key qualities of character are major when it comes to preventing ACEs or future ACEs, adverse childhood experiences. Because just because you maybe think somebody's 18 years old and you're like, well, it's too late. How are we going to have an impact on adverse childhood experiences? Well, first off, the brain is still developing until around the age of 25 is when the brain is fully developed. So we still have an impact there. But even one step farther, kids kids eventually have kids. So even though you may think, well, it's too late for this person, they're already in their 20s or they're 30 years old, continuing to educate people, even if they're not a kid or don't have kids, well, everybody who has kids at one point in their life was a kid themselves. So as we educate about these adverse childhood experiences at any age, we're giving people the opportunity to change the path, to change the likelihood that they will experience or be on the other side of adverse childhood experiences, being responsible for some of the experiences that they may not have realized they were responsible for as it relates to their kids. In the active parenting program, we talk about build resilience, takes a look at the what is called the think, feel, do cycle. And I won't get into this in depth. I'll briefly hit on it just for time's sake. The think, feel, do cycle, looking at how events in a young person's life trigger them to think a certain way. And this isn't always going to be front of mind thinking where something happens in their life and they start thinking, oh, all of these other experiences have happened in my life, so I'm going to feel a certain way and do something. What it's saying is that an event will trigger certain thoughts, whether they're conscious or subconscious, relating to that event. So relating to drugs or alcohol. That could be positive or negative views of drugs and alcohol. It could be media influences. It could be peer influences. It could be experiences that they've had in their life. All these things start to get stirred up, I guess, in their subconscious or conscious mind, and that causes them to feel a certain way. You can have positive or negative feelings relating to that, which results in positive or negative behaviors, which in turn can have positive or negative consequences. We look at this in a lot more depth in the active parenting workshops. I encourage you all to check them out. If you haven't done so already, you can check out our website. We have a listing of our workshops that are free for parents to attend. Or if you're anybody in the community you want to attend, I highly encourage you to check out the active parenting workshops, because this goes beyond what parents can do. It goes into what teachers can do, what law enforcement can do. It's called active parenting, but I'd say it's really active living. And it's how do we instill qualities of character in ourselves and in each other to help build resilience in young people. What can parents do to encourage, have positive encouragement at different levels of the think, feel, do cycle is something we get into more in the program as well. Things like encouraging positive values and rational beliefs help to affect that think part of the think, feel, do cycle. Encouraging positive behaviors, talking about feelings, addressing feelings. There's different things that parents can do at different points throughout that think, feel, do cycle to hit the pause button so we can turn a failure cycle hopefully into a success cycle. And this is, I know at first glance it's a huge concept and it may not make 100% sense, and that's because we spend a lot more time on this in the program itself. So check that out, or at least check out the Active Parenting website where you can purchase some of the books. We provide the books for free during our Active Parenting workshop if you do want to learn more about success and failure cycles and building resilience. And talking about discouraging influences, how we can turn those into encouraging influences is a major part of the program. Because most of the things that parents do don't come out of negative intentions. Most parents don't wake up thinking, I want to have a negative impact on my kid. Most things that parents do are because they have positive intentions. But how do we take those positive intentions and turn those into intentional actions? This was a webinar that we did probably over a year ago. You can check that out for more information. But it's about taking discouraging influences, things that we're doing because we want to change the behavior of our young people, but those can actually have discouraging outcomes for our kids. So how do we turn those into encouraging influences? And some of the encouraging influences are building on strengths, showing confidence in young people, valuing the child as is, recognizing that not every child is going to be perfect at everything in life, and that's okay. Recognizing what those strengths are, being confident, and valuing the child as they are for what they have to bring to the table is a major part of this. And then stimulating independence. These are some of the ways that we can have an impact on adverse childhood experiences. The Centers for Disease Control and Prevention break it down into these 8 categories of impacting adverse childhood experiences. And what I just talked to you about being what we do here, that would be the parenting training programs. That speaks to that part of adverse childhood experiences, and that piece of the puzzle that is the greater solution for how we address adverse childhood experiences. Some of the other things that we can do relates to social support for parents, looking at high-quality child care, and a number of other factors that you can see here. What I like to do is I like to open up the floor. For you guys, I know you probably, your mind's been all over the place as we've been talking about adverse childhood experiences and how this impacts maybe yourself, the job that you do, your kids. Does anybody have any comments about how they can see how adverse childhood experiences play a role in their job? If you're a teacher, if you're a social worker, if you're in nonprofit, if you are in government, does anybody see how these are tied in, how these can be tied into what you do? And if you have any ideas or solutions or some programming that you're doing that you want to share with people that they can look at for further information, because we're all probably fitting into one of these puzzle pieces in the greater solution to adverse childhood experiences. So if you have anything that you want to share, feel free to share that in the chat box or follow up with me after the webinar as well. And I want to be able to share all of the resources that we have in this room right now. It's not just me sitting up here talking. It's about you guys that are listening as well, and the programs that we're all doing. If you're a parent, the things that maybe you've done at home or that you've seen or questions you have, it's this community effort that is going to solve problems relating to substance abuse and problems that we have in society with mental health and changing that stigma. So feel free to forward me those ideas, solutions, programs that you're doing, and I'll get that out to everybody who's here right now, as well as I can share those on our website. I can share those on social media, and the more we all connect with one another and we provide those puzzle pieces to the community at large, the better we're going to be at tackling some of these issues. People talking about posters that they can use for high school. There's infographics that we developed here at DrugFreeAZKids.org that are about certain substances, and that can be a piece to the puzzle. There's also different posters and infographics that relate to adverse childhood experiences that can be posted in maybe a workroom at a school or at a counseling office where social workers, teachers, concerned parents maybe that talk more about adverse childhood experiences. I will make sure to send you guys out links to those. I don't have posters of those infographics that I can send out to you all. However, I can send you files that you can print out and you can put up on a bulletin board that you can share on your wall on Facebook along with those funny cat videos, right? The more that we can get information out about what adverse childhood experiences are and it becomes part of the dialogue, the easier it's going to be for us to deal with the issue. Also, there are some great websites out there. A couple that I came across that I like, where you can actually, some of these you can order different materials from them. This is called Resilience Trumps Aces, and you can see the play that they have on aces and hearts, like in a deck of cards. I believe it's 42 strategies that they have for building resilience in young people on their website. And you can order some of the materials. I haven't ordered them myself yet, but I plan on doing so, where they have different materials that are interactive for you to use in the work that you do, or just as an individual to grow and to learn. Another website is that you can go to that has a lot of news and blogs and will connect you to different resources relating to ACEs would be aces2high.com. Great resource, tons of articles, and they try to stay relevant. You can see in the middle, where at the bottom where it says the making of a murder, and we start to think about some of the different things that we see in our daily lives and how ACEs have a role in a lot of these different things that we see, making of a murder being one of those. So they have a blog that talks about making of a murder and kind of how it relates to trauma and ACEs as well. Is there information available in Spanish? I will make sure to send out as much information as I have in Spanish as well. Thank you for reminding me. The majority of it's probably going to be in English, but there is a ton of information that I've come across in Spanish as well, and I will send that out to all of you as well. So ACEs Too High and Resilience Trumps ACEs, two great websites. You can also check out our website. We have a ton of resources on there relating to substance abuse, preventing substance abuse. We have different blogs, things like ACEs, trauma, anything relating to young people and or substance abuse. We try to talk about it in one way or another on our website through videos, interactive media, blogs, and a number of other resources that we have there. What I'm going to do at this time, just for time's sake, I know some of us may need to get out of here, I'm going to put a survey up on the screen. I'm going to ask if you guys can take that survey. It's just a few questions that will enable us to make our webinars better, to make our services even better. You can let us know if you found the webinar to be useful, if you learned more about the topic or any of the topics here, how you found out about the webinar. It lets us know better how to promote the webinars. Any comments that you can provide allow us to improve our programs. Our programs are funded by the Governor's Office for Youth, Faith, and Family. They allow us to do these webinars, one-time presentations, as well as our active parenting workshops that we provide to the community at no charge. We also have our Community Alliance program that you can find more information about on our website as well. If you have questions, feel free to put those in the chat box right now and I can get to those. Any questions you have. Also, at this time, if you are watching this webinar with somebody else, so you're logged in under one name, but maybe there's 2 of you, 3 of you, 4 of you, 20 of you. I know some people put it up on a screen in their break room and they watch it. Can you let me know? In the chat box, you can simply put +1, +5, how many additional people that are watching. That way I can just have a better idea of how many people that this webinar was attended by. I would greatly appreciate it. And any other questions that you have? Let's see, we do have a question here saying, do you guys come out and provide training for organizations? We don't provide training for the adverse childhood experiences, but we do provide training and programs relating to substance abuse and strategies for preventing substance abuse in general, and we can tweak those presentations to be relevant for who we're presenting to. We present to parent groups, we present to other nonprofit organizations, we present to teacher groups, to churches, community leaders. So we do provide presentations to other organizations as well. If you are interested in that, feel free to contact me. I'm going to give you guys about 2 seconds. I'll give you 5 seconds to wrap up that survey. So if you're typing something in there, make sure to do that really quickly for me. And what I will do is I'll put up my contact information. So we'll give you 5, 4, 3, 2, 1. I see final people clicking. And thank you guys for that. All right, I'm going to put up my contact information right there. Feel free to email me, justin.mcbride@DrugFreeAZKids.org. You can call me 602-264-5700, extension 11, and ask me about our other services and programs or presentations that we offer. I'd be more than happy to talk to you guys about that. Also, I'll come back to the contact info if you don't have that. If you haven't written it down, don't worry. Our lunchtime webinars, if you go to our website, you can see a listing of all of them archived. And I will be sending out to this email, I will also be sending you a link to our YouTube playlist, which is what I use to host all of the webinars, and it has all of the webinars that we do have available online in one place. So if you have staff meetings, or if you just are bored one day and you want to educate yourself more about the various topics that we talk about, this is a great place to go to. If you do share this with your staff, say you have a staff meeting, I know most of the webinars are a half hour, so I know organizations will play these at maybe a monthly staff meeting, and they'll incorporate them in. Just shoot me an email and let me know. There's no cost, there's no charge for you to do that. It just helps me have a better idea of when our message is getting out there, and how many people are making use of the tools that we have. All right. So can we send the links? Yes, I will be sending everybody links to everything that we've talked about and more. And as long as you registered for the webinar, so if you're listening to me right now live, your email, I should have your email captured. If you are watching this in the future and it's a recorded version of the webinar, you can contact me here at justin.mcbride@DrugFreeAZKids.org, and I can send you those links. Also, if you're watching this recorded, if you look in the description below, I will have a list of all the links to the resources that we discussed in the webinar. With that being said, I do not see any more questions, so I'm going to go ahead and end it here, and thank you guys so much for taking an hour out of your day to learning more about adverse childhood experiences and substance abuse. I look forward to talking to you in the future about our upcoming webinars, where we talk about a number of different subjects. Next month, being April, we will be talking about marijuana. We haven't done a marijuana webinar in about probably the past year, so we have a lot of new updated information and statistics to provide to you. That webinar will be provided on April 20th. And yes, that is 4/20. Just happens to be a Wednesday, so we figure Wednesday's the day we do webinars. Let's tackle the issue of marijuana on 4/20 this year. So sign up for that webinar at DrugFreeAZKids.org/webinars. Thank you all so much for joining us, and have a great day. Bye-bye.